Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. Which of the client's statements would notify the nurse that the patient might be suffering from GERD? 1. When I climb the stairs in my house, my chest hurts. 2. I always carry antacid pills with me. 3. My husband claims that I snore loudly at night. 4. Every day I consume 6 to 7 soft drinks. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on antacids. We will first learn about the actions of this medication, adverse reactions, and contraindications. Antacids are typically used for hyperacidity, hyperphosphatemia, hypomagnesemia, and postmenopausal hypocalcemia. We will learn which medication treats each disease. Let's first discuss how it works. Antacids raise the pH of the stomach and lower the overall acid load in the GI tract, which lowers pepsin activity. They also improve the tone of the esophageal sphincter and fortify the gastric mucosal barrier. Here are the adverse reactions for this medication class. Aluminum-containing antacids can result in intestinal blockage, hypophosphatemia, constipation, osteomalacia, and aluminum poisoning. Magnesium-containing antacids may result in hypermagnesemia, especially in renal failure or diarrhea. Rebound hyperacidity, milk alkali syndrome, and constipation can be brought on by calcium carbonate, magnesium oxide, sodium bicarbonate, and magaldrate. Okay, this is important. Let's now learn about contraindications of this medication group. Patients with severe renal illness should not take magnesium oxide or calcium carbonate. Patients with hypertension, renal illness, or edema, those who are vomiting, those on sodium-restricted diets, or those taking diuretics or continuous gastrointestinal suction should not take sodium bicarbonate. Give magnesium oxide with caution to individuals who have mild renal impairment. Elderly patients, people using anti-diarrheal, antispasmodic, or anticholinergic medications, people who are dehydrated, fluid-restricted, have chronic renal illness, or who may have issues with intestinal absorption should be given aluminum preparations and calcium carbonate with caution. Antacids should not be taken by pregnant women without first speaking with their doctor. Antibiotics may be taken by nursing mothers. Changes in fluid and electrolyte balance in newborns are more likely to cause major side effects, so keep a close eye on them. Elderly patients are more likely to experience negative responses. Keep a careful eye on them and use caution while administering magnesium oxide, calcium carbonate, and aluminum preparations. Let's now focus on the commonly used medications of this class, starting with aluminum hydroxide. Aluminum hydroxide is used to treat acid indigestion. This medication specifically works by strengthening the gastric mucosal barrier, increasing the tone of the esophageal sphincter, neutralizing the acid in the gastrointestinal tract, and raising the pH of the stomach to lower pepsin activity. Side effects are the following. With the central nervous system, side effects are encephalopathy. With the gastrointestinal system, side effects are constipation and intestinal obstruction, metabolic hypophosphatemia, musculoskeletal osteomalacia. Okay, excellent. Now let's learn about nursing actions for this medication. Keep in mind that this drug may lessen the impact of tetracycline absorption. Antacids should be given 1 to 2 hours before tetracycline, as it may lessen the effects of quinolone. Antacids should be taken at least 6 hours prior to or 2 hours following quinolone. Drugs with an enteric coating may release too soon in the stomach. Doses should be separated by at least 1 hour. Patients with chronic renal illness should use this medication with caution. Be sure to shake the suspension well. Patients with significant renal impairment, such as dialysis, encephalopathy, or osteomalacia, should be monitored for aluminum poisoning. Dialysis does not effectively remove aluminum. With nursing actions comes patient education. Here are some points to teach the patient. Give the patient instructions to thoroughly shake the suspension and then follow up with a tiny bit of water or milk to help in passage. Urge the patient to inform the prescriber of any gastrointestinal bleeding symptoms, such as coffee ground vomitus or tarry stools. Calcium carbonate. Calcium carbonate is used to treat acid indigestion and as a calcium supplement. In particular, this drug lowers the overall acid load in the gastrointestinal system, raises the pH of the stomach to lower pepsin activity, fortifies the stomach mucosal barrier, and enhances the tone of the esophageal sphincter. Side effects are the following. With the central nervous system, side effects are headache, irritability, and weakness. With the gastrointestinal system, side effects are nausea, constipation, flatulence, and rebound hyperacidity. Okay, excellent. Now let's learn about nursing actions for this medication. Before administering, shake the suspension thoroughly. Note the quantity and texture of the feces. Use stool softeners or laxatives to treat constipation. Keep an eye on the calcium level, particularly in individuals with mild renal impairment. Keep an eye out for symptoms of hypercalcemia, such as headache, nausea, vomiting, anorexia, and confusion. With nursing actions comes patient education. Here are some points to teach the patient. Remind the patient not to take calcium carbonate carelessly or to change antacids without consulting their doctor. Patients who take chewable tablets should be instructed to chew them well before ingesting them and to drink a glass of water afterward. To make passage easier, advise the patient using the suspension form to shake well and take it with a little water. Encourage the patient to report any GI bleeding symptoms, such as tarry stools or coffee ground vomitus, to the prescriber. Let's go back to that question we had in the beginning of the video. Which of the client's statements would notify the nurse that the patient might be suffering from GERD? 1. When I climb the stairs in my house, my chest hurts. 2. I always carry antacid pills with me. 3. My husband claims that I snore loudly at night. 4. Every day I consume 6 to 7 soft drinks. The correct answer is 2. Antacid use on a regular basis is a sign of acid reflux. Did you get it correct? Pharmacology tip. Excessive use of antacids can cause metabolic alkalosis, and signs and symptoms are stiff muscles, tingling in extremities, and dizziness. Also note that antacids tend to slow the absorption of other medications. Alright, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.